to 3 A&P Griffins. Hey, listen, on today's virtual A&P lesson, we're going to talk about the nervous system 2, and we're going to focus on the action potential, which is what is happening at the center of this slide here. We've got two neurons connecting, and you can see that there is a little spark there. You think of the action potential as the spark to the flame. Remember, above and beyond all else, that the neuroendocrine system controls everything. That is, they are the conductors of the A&P symphony. Take that to mean that every cell, tissue, organ, and system is controlled by nerves and hormones, the neuroendocrine system. It's a testable information right there. So I'm going to go through these slides fairly briskly, just giving you the big picture. You can focus on the details on your own. Remember that all cells are going to maintain a potential to fire. They're going to think about the plasma membrane, the cell membrane, how it's a selectively permeable membrane, and across that, you can imagine that phospholipid bilayer. Across the phospholipid bilayer, we've got a potential, basically difference in charge, as we're going to talk about there, but between the inside and the outside of the cell, there's a little bit of a difference in charge that is maintained, and that sets up the potential for a nerve to fire. And nerves firing are called action potentials. Here we've got all those different plus and minuses indicating the charges, and here we've got a meter that's going to electrically determine what our membrane potential is. Okay. Here's the phospholipid bilayer. We know that we have various ions that are inside the cell and outside the cell. When I say ion, I'm talking mostly about sodium and potassium. In the extracellular environment, we've got a lot of sodium, and in the intracellular environment, there's typically more potassium. There's going to be a structure that we've talked about before. It's called the sodium-potassium pump. It's very, very important. If you can imagine, a little pump, and one way is going to be pumping a sodium ions, and the other way it's going to be pumping the potassium ions. The difference is that there's going to be a membrane potential setup. It's, imagine yourself, have you ever shocked yourself, walk across the carpet and you touch a metal doorknob? It's like every step you take, you are accumulating friction, you're accumulating potential energy, and then when you press or touch the doorknob, the charge fires. Think of an action potential kind of like that. And so, at every moment, the sodium-potassium pump is like you scuffing your feet across the floor. It's setting up the potential to fire, and if there's a sufficient stimulus, it's going to fire. We call that the potential for the nerve to carry an impulse or fire. The polarized membrane, potassium inside, sodium outside. These are minerals. Right? These are ions. See, they've got a little charge next to them. All right. So, as stated, we've got the sodium-potassium pump, this little purple oval in the center of the phospholipid bilayer. It's constantly setting up this charge in the membrane. Here's an example of a nerve firing. As we're going to talk about, we're going to break down exactly what's going on. But imagine that you could hook up a wire to a cell membrane. Stick a little electrode in the membrane. If there was a sufficient stimulus, this is what it's going to look like when the nerve fires. So from down low, the nerve is going to spike, and we would be able to read this on that meter, just like that. We're good to go. There's a sufficient stimulus. Boom. The nerve fires, and then it's going to move back to what's called the resting membrane potential. We'll talk extensively about that. And if you look up yonder here, it's going to talk about what the what happens, the sequence of events that make a nerve fire. Once again, we're talking about ions. So here's sodium. Right here, we're chilling out. We're talking about negative 70 millivolts. The sodium, there's a sufficient stimulus. Boom. We touch the doorknob. The sodium channels within the membrane are going to open. That is going to cause the membrane to depolarize. Imagine a bunch of dominoes falling, or a zipper going, or some sort of electrical charge. There's a chain reaction. Boom. The sodium membrane, sodium channels open and get to the top. The nerve fires sufficiently. Then the nerve is going to go back down to the normal resting membrane potential. That is dictated by potassium channels opening. So on the rise, sodium channels open. On the descent, potassium channels open, and we're back down to the resting membrane potential. You see where it says threshold here. All right, the threshold is just this. It dictates the stimulus when the stimulus has been met, when there's a sufficient stimulus that tickles that membrane. That is where the nerve begins to fire. So if you notice that the red line starts below here, it says negative 70. We're going to talk about negative 70 millivolts. Once a nerve fires and it meets threshold, it's going to boom, boom, bang. It's electric. Boogie, woogie, woogie, right? The maintenance of the membrane potential is going to be dictated once again by that sodium-potassium pump. All right, so negative 70 millivolts is what your average cell membrane is fluctuating at. It hangs out at negative 70 millivolts. That is this red line right here. When the sufficient charge occurs, boom, boom, the nerve fires. Over here, to the right, this image, all this up and down and up and down and up and down, these are all stimuli that are coming in. So let's say we get just a tremendous amount of stimuli that are coming in. Once it passes threshold and the stimulus keeps coming, the nerve is going to fire just like that. So if you're looking at your little meter, you'd see that all that activity on your graph. Cell membrane, phospholipid bilayer, ions setting up a membrane potential, sodium-potassium pump, and its role in setting up the charge, scuffing your feet across the carpet, touching the doorknob. Pow! There it is again. Okay, when a nerve fires, when a neuron fires, remember we talked about all the different structures about the neuron. We've got the cell body, we've got the dendrites, we've got the axon, we've got the end of the axon, which is the axon terminals, and that they're going to squirt out neurotransmitter. If we want to, at the end of that wire, essentially, at the end of the neuron, we can do one of two things. We can turn something on, which we're going to dub excitation, or we can shut something off. It's called inhibition. It's as simple as that. Excitation, the nerve fires, it's going to turn a process on, activate something. Inhibition, the nerve fires in efforts to stop a process or turn the light switch off. Yes? So an excitatory potential is going to be something that switches something on. An inhibitory potential shuts something off. Graded potentials, all that means is that you can have a stimulus coming in. Maybe you have, so stimulus 1, you have a second stimulus right after that, and the stimuli keep coming. You can see how the graph goes up, and all of these stimuli are going to overlap, and the end result is that you're going to get a lot of activity, a lot of nervous activity where the nerve fires. Stronger stimulus, stronger action potential. Simple as that. Remember that an action potential is, it's electric, boogie woogie woogie. Action potential is nerve firing, nervous impulses is another term for it. Here's how it happens, and this is a great slide because it tells you exactly what's going on in this graph. Remember, the resting membrane potential starts at negative 70 millivolts. We've got stimuli coming in, on a on a chemical level now. The sodium channels are going to open. That is going to cause the action potential to begin. So this spike upward, sodium channels open. Gets to the peak, the sodium channels shut off. And then the potassium channels open, and the nerve impulse is going to return back down to resting membrane potential. And then finally they close. So sodium channels open after the stimulus. Upon the stimulus, they close at the top. Sodium or potassium channels open, then they close at the bottom. And you've got your little nervous action potential spike, and that's what's happening when it occurs. When a nerve fires, it's called a depolarization. The membrane depolarizes. I know it's strange that you use that term, but that's what it is. Resting membrane potential, negative 70 millivolts. Membrane depolarization, aka action potential, boom, and then the nerve is going to repolarize, or basically reset itself so that it can fire once again. So depolarization, nerve fires. Repolarization, the membrane gets ready to fire again. There's a refractory period. All right. So what that means, what refractory period means, is that after a nerve fires, it can't fire immediately again. So it doesn't sound like a lot, but for a nerve, 0.5 milliseconds. So a very, very short period of time. Mommy, stop licking your tail. Stop it. It's my dog, Mommy. I don't know what's going on. She keeps licking her ass. She got a little raw part just by her tail, the caudal aspect. I love you, Mom. You're such a good sweetie. Good, love you, girl. Just relax. Stop licking your ass. Or should I be anatomically correct? Stop licking your anus. Refractory period is this. After a nerve fires, you got half a millisecond, a very short period of time where it can't fire again. And that's called the absolute refractory period. And that area, Mommy! Good. This area is called the absolute refractory period. You can't fire a nerve during that period of time, that short period of time. If it goes beyond half a millisecond, you've got the relative refractory period, whereby the nerve can fire, but the stimulus needs to be really, really strong. Think about this in terms of, for lack of a better analogy, sex or ejaculation, whatever, masturbation. What are you ever up to do? Whatever you're doing. Just practice safe sex, all right, guys, gals? So after ejaculation, at least a male, there's a period of time where, they lose their erection and they are unable to ejaculate again. You can't ejaculate, twice in a row within a few minutes or whatever, right? But if you give it a little bit of a rest and you get back to it, there's something called what we're going to call a relative refractory period, where the male can once again get erect and is aroused and is interested and is able to ejaculate. That's kind of what's going on with these nerves. A nerve can, quote unquote, fire. It can't fire right after it's fired immediately, right? It needs a little bit of rest. It's called the absolute refractory period. Relative refractory period, a couple seconds go by, we're back in business. Good? Good. Think about the action potential, as I said earlier, like the dominoes falling or an electrical wire firing. It's very, very fast. And you see that these charges are set up. As the membrane depolarizes, if you're thinking about an axon from a neuron, that long wire that's covered with a myelin sheath, the insulation on the wire, nerves are fast, but it takes a while. So this is the sequence. So here's the positive and negative relative charges across the membrane. The nerve fires, and it's going to go in this direction towards the end of the nerve, and it's going to release a neurotransmitter right here, as we're going to talk about neurotransmitters. So this is the business end of the nerve right here after it fires. And you can see that happening here and here and here. Something called saltatory conduction, which is very important in terms of those myelin sheath. There's a structure on the axon called nodes of Ranvier. And they look like little tic-tacs or little sausage links, and you can see them right here. Right? So the sausage links would be the myelin sheath, and then this is a node of Ranvier, or Ranvier. And then this is one of the sausage links, another myelin sheath. And remember that the myelin sheaths are produced by a particular glial cell called a Schwann cell in the peripheral nervous system, so in the nerves within your arms and legs, and within the brain and spinal cord, it's an oligodendrocyte is a little cell, and they wrap themselves around the axon. Momi, stop! Sorry. So, what's the big deal with saltatory conduction? It makes the nerve fire very, very fast. So, rather than going all the way down this wire, the action potential or the nerve impulse is kind of going to hop like this. It's going to leapfrog. 1, 2, 3, 4. Very, very fast, very, very quickly, because of myelinated fibers, or these the axons are covered, wrapped in this fatty tissue, essentially. That's what myelin is for the most part. It's a fat, and it's like an insulator in a wire. Helps things to go very, very quickly. If we strip the myelin sheath off and the nodes of Ranvier off, then these nerves will be very, very slow comparatively. The thicker the nerve and the more myelin on it, you see that there's a myelin sheath wrapped around this wire. You see all in the purple here, the center, that's all the axons. And the axons are surrounded by layer upon layer upon layer of myelin. The thicker that nerve, the faster it is going to conduct. Remember that. And there are certain disease processes we're going to talk about where if we were to strip the myelin off the nerve, then the nerves would kind of short out like a wire, a bad wire. Oh, what's going on here? I guess I get a short in this wire. What's going on? You got no myelin on it. So demyelinating disease is like multiple sclerosis. It's no good. It sucks. Synapses. So when a nerve fires and it gets to its destination, as I stated, you can either turn something on, that's called excitatory. You can shut something off, it's called inhibitory. All right? So we have two different types of synapses. So this one here is going to be an electrical synapse. You could think about this like those intercalated discs within the heart tissue. Remember each of those myocardial cells are connected together, kind of like a Christmas light, I use the analogy, and when you plug them in, they all light up together synchronously. So that would be an example of an electrical synapse. You can see that the charge just hops across the cell. Then we've got the chemical synapse, which is what we are talking about mostly in this lecture. When a nerve gets to the end, the action potential fires down. It gets to something called the synaptic bulb. And you can see like that this structure right here is kind of a swollen area. And within that synaptic bulb, you've got some different structures here. We've got some calcium channels, and we've got neurotransmitters that are just hanging out here. And neurotransmitters, as we will discuss, are chemical messengers. So when the impulse gets down here, there's a chain reaction that occurs chemically, and the neurotransmitters are squirted into what's called the synaptic cleft. And on the other side of the synaptic cleft, there are these little receiving proteins in green, and they're going to catch the neurotransmitter and basically make the connection. All right, you want us to do this? Good to go. So here is that AMP. This is the synaptic bulb. This is the synaptic cleft. And this is the cell or other neuron or whatever on the other side. And you see it's got these red proteins over here, and they're going to be catcher's mitts. When these vesicles containing the neurotransmitter pop and they're squirted out into the cleft, they're going to go right across the way, and they're going to link up, and some sort of message is going to be received. Turning something on, excitatory, turning something off, inhibitory. Synapses. So look, you can have synapses attaching to other neurons every which way. So here is one that's plugging into the axon of another neuron. Here is one that's going to attach to another part of an axon. Look at all these synapses, and they're going to link up with the cell body. So wherever they want to send a message, they're going to plug in to another neuron or another structure, a cell. And they're going to, let's say a nerve is going to, we're talking about a motor neuron. The motor neuron is going to, as we know, plug into skeletal muscles, and it's going to release a bunch of chemicals there. Calcium is going to flood into the muscles, and they're going to contract, right? Turning muscles on. So that's all this is. Axodendritic. All right, so the one nerve is going to plug into the dendrites of another nerve. Axosomatic, hey, now we're going to plug into the cell body. Axoaxonic, we're going to have a nerve plug into the friggin' another axon. So I talked about this, the action potential. Here's the cell body. Here are the dendrites coming in, look like little trees. Think of them as antennae. They're reaching out for information. They receive it. They shuffle the cards in the cell body where all protein synthesis and all the control centers at. And then the nerve is going to fire. Here's the end of the nerve firing. Gets to the synaptic bulb. Calcium ions are going to come in every which way. Neurotransmitters released into the cleft. This cell over here is going to receive all the information. It's called a postsynaptic neuron. So if this is the presynaptic neuron, here's the synapse, and this is the receiving neuron over here. So that's called the postsynaptic neuron. Receives the neurotransmitters, gets the message, picks up what you're putting down, and good things happen. Cool illustration. Propagation of an action potential, depolarization of the membrane. We got the calcium coming in. We got the neurotransmitter squirting out. We got the cleft. We have the postsynaptic neuron, receives the message and passes it on. Sequences of action potential. Breaking this down big time for you, right? So, action potential or the depolarization of the membrane in one neuron is going to reach the knob. Calcium ions are going to flood in. Boom. Calcium is going to cause these synaptic vesicles to pop and release their neurotransmitter, their chemical messenger inside the cleft. The neurotransmitters cross the cleft and link up with the postsynaptic neuron. And look at this crazy, friggin' confusing ass graphic. But all this means, as I touched on earlier, EPSP means excitatory potential. IPSP is inhibitory postsynaptic potential. Turning something on, turning something off, the action potential fires, we're good to go. Once that neurotransmitter or chemical messenger is released into the synaptic cleft and the message is received, we recycle it. So that's what we're talking about by reuptake of the neurotransmitter. Proteins are going to go scavenge up any of the remaining neurotransmitter and bring it back into the system so we can use it again. How are we going to scavenge that neurotransmitter? Remember the glial cells or the neuroglia, those are the support cells that vastly outnumber the neurons. There's a specific one called a microglia you might remember me talking about. Microglia essentially clean up and gobble up whatever, trash, bacteria, anything that we need to recycle or destroy. So those glial cells will help out. Summation. Summation means that you get a buttload of action potentials coming in. The nerve impulse is going to be a lot stronger. Let's talk about memory for a second, right? And all the things that we just talked about in terms of the sequence of a nerve firing. So here we've got a very simple illustration. Here's one nerve firing. Here's the synaptic bulb. Here's the neurotransmitter being sent across the cleft. Here's the receiving neuron receiving the message and sending it, continuing it, or performing some action. The stronger the activity in the synapse, we're talking about thought, learning, memory. The stronger the activity in the synapse and the more efficient that nerve impulse is, the stronger the memory. There's a phrase that I like to use, was passed on to me, goes like this: nerves that fire together or wire together. So for instance, if you perform a certain action, let's say you're into the martial arts and you throw 1,000,000 punches, 1,000 punches a day, 1,000 kicks a day, blocks, all this stuff. You do Tai Chi, you study anatomy, you sleep, you think positive, or you're a nervous Nelly, or whatever the hell. Nerves control everything, right? So if those nerves continually fire down a preferred pathway, the pathway of throwing punches, the pathway of learning A&P, those nerves that continue that path, all that overlapping repetition using the nervous system in that particular way is going to create a preference for nerves firing like that. So think of that in terms of memory. The more you do something, the better you get at it. We learn. Those synapses are firing and they're strong. So nerves that fire together, wire together. What about short-term memory? All right, so we get an impulse sent down the neuron. It's going to, that memory is going to last seconds or minutes. All right? If we just do that activity, kind of do half-assed Tai Chi or martial arts, or don't really study that much, we take a break and we, lose our train of thought, or we go off and do a million other things, then it's spotty. Obviously, in our experiences, we know that those pathways are not going to be reinforced. We're not going to do well on the test. We're not going to do well in that activity. The short-term memory is perishable. It can be lost. It's going to last only a few seconds or minutes. Intermediate memory. You throw a few more punches. You study a little bit more. You fire a certain pathway in the brain. You practice your violin or your guitar. You become better at it. You get accustomed to that sound and the movements and all that stuff. This is called intermediate memory. And there are certain structures and functions around the synapse that become more efficient. They start to learn. Okay, I see what she's trying to do. She's going to play this song on her guitar. So the nervous system is ready for that sequence of events in that synapse. The nerves that are firing together, they're wiring together. Learning is becoming more complete. That's intermediate memory, kind of middle of the road. But if you stop and you play that song this week, but you don't play it again next week, or whatever, you don't practice as much as you can, then that's perishable too. You'll lose it. Long-term memory is where all the structure and function of the nervous system within that synapse and all those pathways are fired persistently, okay, with such repetition that you throw so many punches and you do so many different study strategies, index cards, and reading your text, and listen to Dr. O, and attending lecture, and learning on your own. You fire those pathways so significantly that you master the activity, and then there is a permanent, lasting, long-term memory, which is what we all aspire to. Of course, you think about the storage capacity of the mind being like a hard drive. We can't have so many things jammed in our hard drive because we can't just go to the store and get an upgrade, right? So sometimes we need to offload, erase some crap from our memory, and maybe only just store it in short-term or intermediate-term memory. Sometimes maybe we just want to shit can that memory and forget about it altogether, right? No more of that. I'm not going to fire that pathway. I'm not going to think like that. I'm not going to take that strategy. So long-term memory, remember that all the activities in the synapse, more calcium channels flooding open, more action potentials firing, stronger neurotransmitters are all loaded up, ready for release. And here are some of the neurotransmitters. There's various ones, okay? There's more than 50 compounds that we know of. They're chemical messengers. Norepinephrine is one, and that's good for concentration and focus and energy. Serotonin is the famous one. This is helpful for memory and mood, okay, positive mood. Dopamine is our reward center, all right? Motivation, all driven by dopamine. So you do something and you get a reward. That fires this, it releases a lot of dopamine in your mind, and the neurotransmitter, in the sense of neurotransmitters. So you feel good about what you've done. And all neurotransmitters are chemical structures that are released in the synapse. They are a kind of nervous system hormone. There are various neurotransmitters are released. I said sometimes they turn things on, be excitatory, and other times they'll turn things off depending upon the situation. They have a chemical structure. So all kinds of different complex structures. Their shapes are going to dictate their activity. Their structure is going to dictate their function. So here's serotonin and adrenaline. We know that gets us fired up, gets our heart rate going. And here's dopamine associated with reward. Here's endorphins that we feel after we have a good workout. Our endorphins are flowing, right? They're all neurotransmitters or chemicals that the body releases in the synapse. Different sizes. Acetylcholine is a famous one. It is famous for its activity in the nervous system, firing muscles. So in the synapses where we have those motor neurons plugging into muscles, acetylcholine is an excitatory neurotransmitter. Amines, this dude is flipping out, he's stressed. So here we see, if you don't know it already, this is going to be the adrenal gland that is going to sit right on top of each kidney, and it releases certain hormones, and they are amino in nature. They're comprised of strings of amino acids, right? Nitric oxide is another neurotransmitter. These are just FYI's, examples of them, okay? Here we've got a very complex structure, strings of aminos performing a specific function. It's like a big CVS receipt, right? Very complex. Networks, all right, neural networks. So basically, what is a nervous system? We talked about the fundamentals of it. We know we have neurons, and then we have neuroglia. So philosophically, scientifically, we've got neuron doctrine that basically states that the neuron, okay, which which is the cell body, dendrites, axon, all that cell, the nervous cell, neural tissue, is what it's all about. That's the fundamental focus of our studies scientifically. And then we've got reticular theory, which is basically theorizes that, listen, it's bigger than just the neurons. We've got complex integrated networks. We've got the glial cells, such as the astrocytes and the oligodendrocytes and the microglia, and they're all playing important roles too. So we have to take all things into consideration. So today's neural doctrine, listen, we're learning more and more about the nervous system all the time. So here we've got a complex network of interaction with neurons and neuroglia and all kinds of neurotransmitters firing and action potentials firing off constantly, relaying information, and it's taking everything into consideration. Not necessarily testable information, just understand that our understanding of the nervous system is a growing body of information. It's always evolving as we learn more and more every day. And so we got to understand the fundamentals. Remember that we've got the neural cells, and we've also got the support cells, which are playing important roles, the neuroglia. Different types of disease processes. I'm just going to go over these in a cursory fashion, okay? Multiple sclerosis is a demyelinating disorder. So, God forbid, but we see a this is a horizontal or transverse section of the brain, and we can see this is what's the gray matter, and the white matter is in here, and then we see these white spots, which is not normal anatomy. All right? So these spots are multiple sclerotic plaques. So if you looked at the brain of somebody with MS, you would see that there's this MS plaquing, multiple sclerotic plaquing within the brain. And that is going to correlate with demyelination of neurons, stripping the insulation from around those axons. And so the nerves, rather than firing smoothly, they're going to be like wires that are shorting out, sending spotty messages and information. Instead of it's going to be like consequently, people are going to have problems with motor function, weakness in muscles, all kinds of symptoms. It sucks. I know a few people with MS. Benign tumors, okay? Essentially, we're talking about a tumor, an abnormal growth in the nervous system that is, it's not rapidly expanding. There's benign and then there's malignant. A benign tumor is a better problem to have. So here's one in the brain. It's contained, so it might grow, but it's just going to grow in size itself. It's not going to pass on to or infect in a way, render the rest of the nervous system cancerous. But it's growing. Obviously, just the fact that it's growing can press on the surrounding structures and cause all kinds of problems. A common musculoskeletal tumor that is benign of the nervous system is between each of our, remember I talked about a neurovascular bundle, so between all of our fingers and our toes and between our ribs, etc., we've got nerve, artery, and vein hanging out together. So if you think about your digits of your hands and feet, you can see that there's a nerve between them. And if you get what's called a Morton's neuroma, you start to develop really acute pain, maybe some numbness and tingling between your digits. In this case, looks like of the third and fourth digit. You see that there's a benign growth, a tumor in this nerve sandwiched between the feet. And if you were to squeeze this way, it'd be very uncomfortable. Footwear would be very uncomfortable. Walking, gait abnormalities, all that shit. The patient would be miserable. So what they do is they'll go in, maybe inject this. Maybe they'll just take the nerve out altogether. It's typically a sensory nerve as I understand it, so you wouldn't lose any power to the foot. But that's a Morton's neuroma, a benign process. Malignant tumors, they are growing, they are expanding. They are making other cells in the nervous system cancerous, and it's spreading. Not friggin' good, okay? Now, these most commonly don't originate in the brain, in the nervous system. Instead, they are passed on, typically, through the vasculature, through the arterial system, through the lymphatic system. They would arise from a different tissue, so maybe cancer of the breast, lung, or other bone. That could transfer and wind up traveling to the nervous system and get in the brain, and then it's going to screw all kinds of things up. Very, very bad. Different tumors of the central nervous system, talking about the brain and the spinal cord. So here we've got an astrocytoma, and guess what cell that's going to be affecting? The astrocytes of the brain, which are glial cells. There's another ugly and horrible tumor. It's called a glioblastoma multiforme. Very deadly tumor that's expanding and rapidly growing. There's something called an ependymoma. Remember, one of those glial cells is called an ependymal cell, and what they do is they produce cerebral spinal fluid, which is going to flow around the brain and even down the center of the spinal cord to bathe the neural tissue and to make sure it's got all its nutrition. So that here we've got the arrow indicating that there's an ependymal tumor right here, and that is right where the fluid is going to be circulating from the brain down the cord. So that's going to create a blockage and a backup of CSF, cerebral spinal fluid. It's going to increase intracranial pressure, and that could be a life and death situation. 5-year survival rate. No thanks. An oligodendroglioma. Jeez. All right. So you don't need to know these specific. I want you to know like categories, but just listen. If you know that an oligodendrocyte is a cell that produces myelin sheaths in the central nervous system, which you should know after this lecture, then that's where this cancer originates. And see, it's causing all kinds of havoc. It's pressing in, crowding out all these other structures over here. It's not good. All right. Care if you know survival rates or all that stuff. It's all horrible stuff, But just no trends. So those are central nervous system tumors. Now we've got peripheral nervous system tumors. Here we're talking about an acoustic neuroma. So here's our ear, and we know that acoustics, the acoustics in this room are far out, man. So we're talking about hearing. One of the nerves that helps us process hearing is going to be right here, the vestibulocochlear nerve. So if, God forbid, you develop a tumor on this peripheral nerve, the acoustic nerve, then it's going to create pressure, hearing problems, equilibrium problems, and here you see the tumor doing its dirty work. I've known somebody who's had this. It's not pretty. It can cause a lot of horrible problems. Neurofibromatosis, the elephant man had this, okay? You see how it's very disfiguring, horrible. Tumors affect the skin and create all kinds of disfiguring tumors. Listen, I want you to understand this much, that the nervous system controls everything. The neuroendocrine system controls everything. It's a test question. Nerves and hormones, the conductor of the symphony, all right? Nerves fire via what's called an action potential. There's something called a resting membrane potential, and when the threshold of stimuli is met, boom, zzz, the nerve is going to depolarize, and the sodium channels are going to open, and then they're going to close. And then when it gets to the top, the potassium channels are going to open, and then it's going to descend, go back to normal resting membrane potential, then they'll close. and that we got the friggin' sodium potassium pump that sets up these charges like you're scuffing your feet across the carpet and touching the doorknob. Yes? All right. When we send a nerve impulse, it's either at the end we've got the synaptic bulb. It's going to squirt out a neurotransmitter, numerous kinds. Maybe the neurotransmitter is going to turn something on. It's called excitatory. Maybe it's going to shut something off. It's called inhibitory. Neurotransmitters are basically type of hormones that are released into, that are used to communicate in the nervous system. But there's another system that I just mentioned, the endocrine system, which consists of glands and hormones. Nerves and hormones work together to make good things happen. Remember that learning, we got short, intermediate, and long-term learning. Short-term memory is stuff that we just do in passing. Maybe we're kind of half-assing our study techniques or whatever. It's not gonna be shunted into intermediate and long-term memory. We're gonna forget it really quick. If we really want to learn, we need to focus on something and continue to send that information down that pathway. Remember I said nerves that fire together, wire together, reinforcing a neural pathway. Right? So that is a permanent memory. Right? We're learning more and more about the nervous system, and that, of course, in our studies of AMP, we understand that all AMP as we age, and as we encounter challenges to our homeostasis, disease may strike. There's different types of tumors that affect both the central nervous system, brain and spinal cord, and the peripheral nervous system, which are all the nerves that exit the spine and are found in the extremities. Yes? So, some heavy stuff. Remember the basics of it. Study hard. I'll see you on Tuesday. Wow.